Good afternoon. Welcome to day 362 at the EMA office as we are quickly approaching the 1-year anniversary. It won't be long, and we will be celebrating 1 year. But today we have Chairman Kern with us, and Randy Randolph. You get to be the numbers gentleman today.
I do. Thank you. Appreciate that. So we'll jump right into the numbers here. For St. Clair County totals, we've tested a total of 294,933. That's an increase of 725 since yesterday. Of those, 58 were positive, males and females under the age of 10 through their 90s. That brings our total positive test results in the county to 28,533. Our daily county positivity rate today is 8.0%. 266,400 of the residents that have been tested have been negative, and we're happy to report today that we have no additional deaths. But it leaves our total still at 459 deaths, which is quite a few. And I like to remind our viewers that we talk about these numbers every day, but really what we're talking about is people. So if you keep that in mind. Those that have completed the IDPH required 10-day isolation period are 27,531. For state totals, they've tested 18,804,759. Of those, 1,202,709 were positive. That's an increase of 1,682 since yesterday. And for deaths, they're reporting an increase of 30 deaths since yesterday, bringing the total statewide to 20,810 people who have lost their lives with the battle with COVID-19, and our thoughts and prayers go out to the friends and families. For hospitalization numbers, those that are currently hospitalized in St. Clair County due to COVID-related reasons are 28, and patients that are on ventilators is 2. For regional hospitalization, those hospitalized are 66, and those on ventilators regionally is 3. We don't have any long-term care facilities and outbreak status increases to report, so that's a good thing. Remember that testing is still available each and every day at the St. Clair Square testing site. That's 8 to 4, 7 days a week. So don't forget to get tested. We can't let our guard down. We still have to remain vigilant. So, Chairman?
How are sign-ups going?
Sign-ups are going well. Many people have signed up for the vaccinations, and we're still getting a lot of interest on the form for the people who are on our next tier that are interested in getting the vaccine when it comes out. So we're excited to see getting more needles and arms as
second doses are happening?
Second doses of Pfizer are happening right now. We're still waiting on a little bit more Moderna to come into the county so we can get those scheduled. But the call center staff are working really tirelessly to get people their appointments, help answer their questions. And so we just ask that if you're calling the call center, please remain patient, that we're trying to give personalized service to each and every person that calls in and make sure that they get their needs fulfilled. So
great. Thank you, Randy.
Thank you
very much. Okay, let's look at the zip code report today. We got a few more zip codes than we've had recently, so let's see if we can reverse this bump in the road. 62201 is up 4 to 564. 62203 up 1 to 608. 62204 up 2 to 388. 62205 up 1 to 632. 62206, we're up 4 COVID positives today to 1274. 62207 up 1 to 578. 62208 up 5 to 1601. 62220 up 5 to 2038. 62221 up 14 to 2754. And 62223 up 4 to 1723. 62226 up 7 to 3153. 62232 up 1 to 885. 62239 up 1 to 457. 62240 up 1 to 157. 62243 up 1 to 761. 62254 up 1 to 789. 62258 up 3 to 1,027. And 62260 up 4 to 787. 62269 up 4 to 3,205. So as we heard from Randy, 58 new positives today, 725 people tested, brings our county positivity way up to 8%, almost double what it was yesterday. The 7-day rolling average, therefore, is up to 5.5% today. Luckily, regional positivity remains the same at 3.7%, and that's largely because other counties are coming in low. Bond County's at 0.2%. Now, Clinton County's at 8.9% today, but Madison's at 3.9%. Monroe is at 6%. Randolph's at 2.5%. St. Clair at 7.8%. And Washington County is at 2.9%. So Herb, a big day here in the studio. Tammy, who is our sign language interpreter, has a birthday today, and we'd like to wish her a very happy birthday. That's for sure, Tammy. And you're wishing yourself a happy birthday now too. Herb.
And Robin Whitaker.
Robin Whitaker,
Brian's
Brian's.
birthday, so all members of Team St. Clair wish them to a happy birthday because they're all part of Team St. Clair, and even though it's been tough on all of us, 362 days, we're all in this together. We've been saying that from day one.
I got to say, you talk about Robin Whitaker, Brian's better half. Brian and Randy, have been here virtually every day. You talk about a 1-year anniversary. I know Brian, I think he maybe had 3 days where he was under the weather and has been here every day, Monday through Monday, no weekends off. And Randy's the same way, working, coming in, running the cameras, making sure everything's right. Now Randy is working on the scheduling, and it's just nonstop. You are the same way. You've been here all the time, and
I'm just getting a little bit more white hair because those guys have been here all this time.
I didn't notice you had hair.
Yeah, thanks. Some of our Team St. Clair members, Carla says, I've had both shots. Can't you tell how happy we are? Thank you, St. Clair County. Those are the kind of comments that we like. A lot of people joining in saying, I got my second shot on Friday. So, that's great. People are taking advantage of it. And that's what we need to do. We need to get as many needles on the arms as possible. Had a nice meeting with the state EMA director today, and she was at the site, just really impressed with the setup there. So we'll be hearing more from her next week. She drove down just to take a look, so she's been hearing about it all the way up at Springfield and wanted to come down and see it firsthand herself.
People were here from Michigan. They were taking pictures and doing drawings of the operation at the fairgrounds. They're reproducing this exact setup in Michigan. So it is what has been built here in St. Clair County really is a template for getting needles in arms elsewhere.
And that's what we want. As Randy said, the call center has been busy, so we continue to ask for your patience. The men and women in there are doing their best to answer as many calls as possible. And I know some people call and say, well, I've been calling and calling, it's been busy. Please keep calling. Somebody will get with you. It will be a live person, it won't be a recording, and they will be able to address your concerns and help you get your appointment or whatever you may need. We've had 110,151 citizens sign up to this date. It's 1,425 since yesterday, so people are still showing the interest. Talking with Mila today, we got some of the vaccine in. The appointments are open, right, Randy?
Yes, sir, they are.
So can you explain to our viewers, for those who may be out there, how they get in there to get that done?
Sure. So if for those viewers that we have that have received notification from the health department, and you may have received that over the last several weeks, you may have had some difficulty getting an appointment when you click on that link. We now have those clinics open. I know a lot of questions have been coming into the call center, and we've been seeing on Facebook, what about my second Pfizer shot? There's plenty of appointments available right now for the second dose Pfizer, so that's really good news. And so the thing that you want to do is, if you're in one of those groups, whether it's 1A, 1B, Part 1, or Part 2, you want to check your email, check your spam folder to make sure that it didn't end up there, because that's, sometimes happens. And follow the link that's in there. They'll ask you a little questionnaire when you get to the website, make sure that you qualify, because not everybody is not just open to everyone right now. So follow those questions, enter the registration code, fill out the information. You should get a QR code to your cell phone that allows you to process a little bit faster at the fairgrounds. And if you're having trouble getting registered, call the call center. And I know a lot of people are calling, and it takes a little bit of time to get through, but our people are registering those that are having difficulty getting through that system, maybe don't have the technology to do it. So that's why we're here. We're really here to help people get those shots in the arm.
And with the second shots, you have to wait until after the 3-week or 4-week period,
Right.
depending on if you had Pfizer, which is a 3-week timeline, Moderna 4 weeks, before you can get your second shot. Don't make an appointment for anything before those 3 weeks, because you're not eligible until the vaccine has a chance to get through your entire system, which the doctors tell us is 3 weeks. After that point, then you're eligible for the second dose.
That's a really good point. I'm glad you brought that up, because you should be receiving a second notification for your second dose. So you would have received that first one to get your first dose, then a second notification will come out from the health department from 24 to 48 hours before your due date for that second dose. And then you follow that link and create your appointment at that time as well. So if you haven't gotten the notification yet, that's because you're not ready. I just got a message from someone today who said, when can I get my second dose, or how do I sign up? Well, they were still a full 7 days away from the time frame being up. So just be patient, and those notifications will come, and just keep checking your email and your text messages, and just make sure, just stay vigilant on those, and that's how you get your appointment.
Well, and that's, and we say, this all depends on the availability of the vaccine. And we can't schedule appointments until we know we've got enough on hand. The last thing we want to do is to schedule people and then run out, and then you sit there, or you haven't been able to get it. So if you get that notification, that assures you that your dose is waiting for you. So go on, get it filled out, and get that needle in your arm. We'll be back with Cindy to translate this into our Spanish communities, and then we'll be back tomorrow for day 363. Everybody have a good evening.
We in the medical profession continue the daily battle against COVID-19. One thing I know for sure is that masks do work. Until a vaccine is available, we must ask for your assistance in slowing the spread of this deadly virus. 3 simple things help tremendously. Wear a mask, wash your hand, and watch your distance. By practicing those 3 basic principles, you can help us in the medical community respond and defeat COVID-19.